It's a pleasure today to welcome two colleagues of mine who I've had the good pleasure of collaborating with, um, who come to visit us, one from down the street and one from down the highway. Am I getting this right? Okay. So the first of our two guests today in these rounds is Dr. Ann Fuller, who's an assistant professor of pediatrics at McMaster University, a pediatrician at McMaster Children's Hospital, who has done some great work on using strength-based approaches to reducing structural inequities in child and family health outcomes. And she is joined today by Dr. Faraz Vahid Shahidi, who's an associate scientist at the Institute for Work and Health and assistant professor at the Dalalana School of Public Health at U of T. Um, Dr. Shahidi is a social epidemiologist by training, and his research focuses on the role that socioeconomic conditions play in shaping the health and safety of folks who work. And today's talk's a really important determinant of health that they're going to be addressing, which is parental employment quality and how that affects child mental health and development. Welcome to CHES Rounds. Thank you for joining.
All right, well, thanks so much for having us here today. As Dr. Cohen mentioned, we're going to be talking about parental employment quality as a social determinant of child mental health and development. I'm really excited to be here with Faraz, a good friend of mine. I'm a pediatrician, as you heard, and have been chatting with Faraz for many years. And over time, we kind of came together to realize that his exposures and my outcomes would be really nice to mix together. And we decided to apply for a Catalyst grant from the Leong Center and are so grateful that we were funded because it really laid the foundation of what I hope will be a long-term collaboration. Hopefully Faraz feels the same. You can ask him at the end and it'll be recorded, so I'll know forever. So we obviously want to thank the Catalyst grant from the Edwin S.H. Leong Center for Healthy Children, which funded this work. We have no other conflicts of interest to declare. So we wanted to lead with the key messages of the work that we're presenting. I'm just going to angle the microphone a little bit. There we go. Which is, firstly, that our research found that many working parents are employed in precarious jobs that are insecure, unpredictable, and low paying. And this comes from a population level look in the province of Ontario and the city of, the province of Ontario and across Canada, that in that context, a sizable share of children are exposed to the negative spillover effects of precarious parental employment, which is obviously of relevance to everyone here in this room. That our evidence suggests that children exposed to precarious parental employment are more likely to experience mental health difficulties and perform poorly in school. And we hope that by promoting access to stable and rewarding jobs, we can improve not only the well-being of workers, but importantly, the mental health and development of their children as well. So we wanted to start with some context about the state of child and youth mental health in Canada. This is a really hot topic we're reading about everywhere. And it's our feeling that Canada is facing an urgent need to address mental health among children and youth. The recent Canadian Health Survey of Children and Youth found that the proportion of youth rating their mental health as fair or poor more than doubled from 12% to 26% between 2016 and 2023. Obviously, with some important effects, we think of the COVID-19 pandemic, but also the changing milieu in terms of socioeconomics as well as social media. Many determinants of child and youth mental health have shifted. And we also all agree that children rely on their parents to provide for their material needs, as well as safe, stable, and nurturing relationships. And these are key to fostering healthy emotional and behavioral development. I think that in this room, we're all behind the child health stuff, but what do we mean by employment quality? And I'm grateful that Faraz taught me all about this over time. So employment quality describes the degree to which a job enables a person to meet their needs and goals. And this is obviously at work in the day-to-day, but this extends to other domains of their life. So aspects of job quality can affect how families interact with each other, the time folks have and resources they have to spend on leisure, on rest. So this is beyond kind of whether you're working or not. It also provides a systematic framework for distinguishing between good jobs and bad jobs. How do we measure this, and how do we know what the effects of job quality are on the health of workers and on the health of their children? So moving from there, we're hoping to frame parental employment quality as a social determinant of health. We all agree that socioeconomic conditions are powerful predictors of child mental health and development. And we propose that socioeconomic status in childhood is shaped in large part by the quality of parental employment. And we're going to use the family stress model essentially to provide a conceptual framework for understanding how this might work. So on the left-hand side, we have our parental employment quality, which can consist of a variety of different indicators, including wages and job stability. So how certain you are that your job is going to be there tomorrow or next week or next year. Work schedules and hours, how many hours you work. Do you work long hours? Do you have insufficient hours to meet your needs? And schedule. So do you have a predictable and reliable schedule where you can plan your life around that? Or is your schedule off hours, fluctuating, inconsistent? And then predictability and importantly, control. Where's the locus of control for your employment? Is it something that you have some control over, or do you really rely on external sources? And in this study, we're zeroing in on red on the effects on child and youth mental health and development. But I just want to offer to you ways that this association might work. So parental employment quality could affect family resources. This is pretty obvious. So the quality of your job is a determinant of your income and material security. For the most part, we rely on jobs to make money and use that money to buy things. But beyond that, it can involve things like access to childcare, access to health, housing, and also to the social support that you have available to help support your family. But then the family stress model and other models of child health and development bring in the idea of processes. So we know that economic strain and precarity in a variety of ways can affect parental stress and parental mental health, and in turn affect parenting practices, the ways that parents and families interact with each other. And more concrete things like time at home to participate in positive parenting, consistency of family routines. So these two mechanisms, family resources and family processes, we suspect may lead to this association with child and youth mental health. But we're not getting into mechanisms today. At a starting level, our objectives were to identify profiles of parental employment quality in Canada, and then to quantify the associations between profiles of parental employment quality and children's mental health and development. I'm going to pass it on to Faraz.
Thanks, Anne. Hi, everyone. Thanks again for having us. So a little bit about some context to our method. So coming into this grant and the project, one thing that we were struggling with was sort of how do we find data that's going to tell us everything we need to know about parents' work, everything we need to know about children's mental health and development, and that's also going to tell us, sort of provide us a recent picture of these phenomena. And sort of the conclusion we sort of reached, and maybe you'll reach a different one, you can share that with us, but the sort of conclusion we reached is that doing that in the context of a single data source is going to be really tough. So coming into the project, we said, what if we tried to triangulate what the sort of next best available data source is? So, can we find a somewhat recent data source that provides us with gold standard measures of, say, child mental health? And then triangulate that with a longitudinal survey that might be a little outdated because it was terminated in 2008, 2009. That is going to sort of maybe better, is a little bit better designed to tell us a story about household employment conditions and precarity and job quality and so on. So today we'll actually be sort of presenting findings from a pair of studies that do some of this sort of triangulating activity. And to tell you a little bit about the data and sample for study one, so we used data from the 2014 Ontario Child Health Study, so a provincially representative cross-sectional survey. Sort of from our point of view, one of the more recent sort of population level data sets telling us something about sort of the state of children and child well-being. So it's a survey of about 11,000 children aged 4 to 7 that also collects some information, including information on household employment among their caregivers. So we included all children. Sorry?
4 to 17.
What did I say? 4 to, oh no, sorry, that should be 4 to 17. That's my mistake. 4 to 17. So we included all children who had at least one parent in the labor force. So for those of you who don't know that terminology, that means you had to either be like actively employed in a job or sort of the legal definition of unemployed, which is jobless but seeking paid work. So that sort of captures some element of attachment to the labor market, even if that attachment implies sort of I'm looking for a job in the labor market. For our second study, we instead turned to the National Longitudinal Survey of Children and Youth. So this is a nationwide representative cohort of about 20,000 children aged 0 to 11, and of course also their caregivers. So for those of you who are not familiar with this survey, it was sort of one of our sort of flagship longitudinal surveys from around the 1990s to the late 2000s, along with the SLID, the NPHS. So these were terminated in about 08, 09. So we do have these families biennially, so every other year from 1994 to 2008, with a maximum of 8 cycles available on the cohort. And in this study, we again narrowed in on children whose parents were in the labor force. In this case, specifically children who were 0 to 5 years of age at cohort inception in 1994. Some additional inclusion criteria in the context of this study that I'll tell you a little bit about sort of why. But just to tell you now, sort of they had to be living in stable dual parent households. So lone parent households were excluded from this study. And we needed to have repeated observations of these children and their parents at sort of various stages of childhood. And I'll tell you a little bit more about that shortly. In terms of assessing child mental health and development, so in the OAKS in study 1, we looked at parent-reported emotional and behavioral symptoms assessed using the OAKS Emotional and Behavioral Scales, the EBS. So 52 items that are assessing symptoms of 7 disorders in the DSM-5. In this case, these scores were sort of added up and modeled continuously, so capturing both the emotional and behavioral dimensions. We also looked at parent-reported school performance using a single item that asked those parents to report on whether grades were at the A, B, or C or lower level. In study 2, and hopefully all this is going to come together by the end of the methods, but a bit more of a sort of developmental and longitudinal perspective on this. So we looked at youth reported, so in adolescence, emotional and behavioral difficulties. So these were assessed at ages 14, 15. So I told you we took children who were 0 to 5 years of age at the cohort inception, followed them up through childhood, and as well as early adolescence, where we asked, well, we didn't, but we assessed emotional and behavioral symptoms using a short form of the EBS. And in this case, I'm going to be focusing on sort of a dichotomous, a binary version of these respective indicators that sort of represent elevated levels of symptomology. So how did we assess the quality of parental employment? I would have loved to have a much longer list for you here because I understand we're all sort of maybe because of our own experiences or maybe because of your own research and such. We're gonna sort of feel that some dimensions are missing, but this is sort of, like I said, sort of the best available sort of portrait we could paint of parents' jobs using population-based data in Canada. So a dimension of status, so simply whether you are employed or unemployed. A sense of hours, so fewer than 30, the standard 30 to what in Canada we call long hours, which is 49 hours or 49 or more hours. So StatsCan calls that long hours, 49 or more. A sense of scheduling, so regular day, regular evening, regular night shift, or are you looking at something more rotating, split, irregular shifts, unpredictable shifts? Hourly wages where we had it, or household income in the case of study 1 where we didn't have hourly wages. And in the case of the NLSEY, which is has a bit more of that flavor of social survey and provides a little bit more content to household employment, we also had number of weeks worked as a sort of proxy for how stable and secure employment is throughout the year. So what did we do with those multiple dimensions? Well, we essentially used latent class analysis to identify groups of households, well, groups of parents who share common characteristics. In this case, characteristics related to their employment. And so latent class analysis allows us to identify sort of groups that have distinct overarching profiles or flavors of household employment quality. And some of those profiles of household employment are going to be higher in quality, and some of those profiles are going to represent households affected by lower quality parental employment. In the case of the OAKS, the goal was to do what we could with the cross-sectional data, which is sort of a single point in time sort of picture, cross-section of household employment quality, describing mothers and fathers' main jobs during that previous week. In the case of the NLSEY, we were able to do something a little bit neater, although with this somewhat older data, where we could actually follow children at sort of 3 stages of childhood, early, middle, and late, and paint sort of create longitudinal profiles or trajectories, if you will, of household employment quality. So rather than a single point in time, sort of what sense do we get of sort of the development or the trajectory of parental employment quality as kids move from early childhood to late childhood? Conventional regression modeling after that, assessing, sort of estimating cross-sectional associations in the case of study 1 and longitudinal prospective associations in the case of study 2 between profiles of parental employment quality and child mental health and development or outcomes. These were adjusted for a wide range of covariates, generally pretty decent overlap between the NLSCY and the OAKS, but to give you some sense of what sort of we were able to account for, so we have the level of children, so sex, age, preterm birth, at the level of parents, education, race, and immigration status, and at the sort of broader household level, factors like sort of household size, urban versus rural geography, and region of residence, proxied by province. Because we sort of anticipate the question coming up because it came up repeatedly in peer review, we actually chose not to adjust for parental mental health status. And this was partly because of the story Anne was sharing with you around how we think, reasonably we hope, that parental mental health is sort of possibly the key, or at least one of the most important sort of pathways linking a parental exposure like the quality of their employment to their children's mental health. So someone like me who's been in the employment quality space can tell you that although I haven't necessarily studied parents until working specifically until working with Anne, we know that sort of quality of employment is going to predict on individuals, including an individual who happens to be a parent's mental health. And plenty of research there sort of credibly pointing to a causal impact of that adult's employment quality on that adult's mental health. So sorry, there was a lot to the methods, and I think partly because 2 studies, triangulation, and so on. But just in case you're not completely following, we wanted to, and that would be my mistake, my fault, not yours. But just to like give you a sense, sort of bring all that information together. In our first study, this is a cross-sectional survey where we looked at a sort of snapshot of parental employment quality, mothers and fathers in both dual and single parent households, and how they associate with contemporaneous EBS scores and school performance. And in study 2, we were able to instead construct these sort of longitudinal childhood profiles of parental employment quality to see how they're prospectively associated with emotional and behavioral problems separately among young adolescents. So moving into results, I'm going to tell you a little bit about what we found for that first objective of wanting to paint a portrait of parental employment quality using LCA, using latent class analysis, and then I'll hand it over to Anne to tell you about results from our regression models, looking at how these latent classes associated with mental health and development among their children. So across both studies, we very conveniently, but we were very happy to see, sort of produce these 5 distinct profiles of employment quality. Although you'll note that in that second study where we focused on sort of stable dual parent households, we didn't have single parents. So on the right side of the screen, that's really only applying to the OAKS. But to tell you a little bit about what these latent classes represent, we had this sort of first class that we qualified as high quality. So parents in this high quality employment group reported generally and overwhelmingly favorable working conditions across the board, across the multiple dimensions assessed. So they were generally employed in full-time jobs, standard hours, predictable schedules, generally sort of regular daytime schedules, with what appeared to us to be sort of gainful and year-round stable wages. This represented, a majority of households among dual parent households, as well as among the single parents. Next, we had this sort of flavor or profile of household employment that we characterized as primary earner. So kind of what you might guess from the label, households in this employment sort of arrangement were sort of characterized by mixed working conditions, where generally fathers were working not just sort of full-time, but very long hours, intense hours, and what appeared to us to be in exchange for very high wages, very high earnings and wages. alongside alongside a second parent, generally a mother, but not always, working shorter hours, so generally part-time, and for much lower wages with lower earnings. And this represented about a quarter of dual parent households. And finally, we had a third group among dual parents in our second group of single parent households that we labeled precarious. So these precariously employed parents reported unfavorable working conditions across the board. So rather than favorable conditions across the board for high quality, you sort of have a converse here. So they were often employed in part-time jobs. They often reported unpredictable schedules and irregular shift work. Overwhelmingly low or lower wages, and limited stability throughout the year with evidence of sort of interruptions, job displacement, or job loss. And this represented in the Oak study, for example, about 1 in 10 dual parent households and about 44% of single parents in that Oaks sample.
Thanks, Faraz. Okay, so I'll move on to our regression results. I'm going to start with study 1. So just as a reminder, this is the Ontario Child Health Study, our cross-sectional survey study. Broadly speaking, we found that all employment profiles, apart from the high quality employment, were significantly associated with higher total score on the emotional and behavioral scale. So that's a sign of higher symptomatology, both for emotional symptoms and behavioral symptoms. But really important to highlight that children in the dual parent precarious group and the single parent precarious group had remarkably higher scores than other children. We also just noticed that in our single parent groups that we found even higher scores among children with single parents who were precariously employed compared to single parents who were unemployed. Oh, I highlighted that. Sorry, that was a double slide. So that's just a key point for us to highlight. And that even though the primary earner model, as Faraz explained, was associated with pretty high wages and in some cases higher wages than our high quality employment model, we saw higher mental health scores for children living in households with a primary earner model. So we draw attention to this because a lot of the research in parental employment initially kind of focused on the idea of mothers entering the workforce and whether it was positive or negative for mothers to enter the workforce. And so we were really interested to find that even with a one parent working shorter hours and potentially being around the house more, and one parent working very, very long hours, even for higher wages, we found higher mental health scores for those children. And I mentioned the importance of that unemployed category having scores that were not quite as significant as the precarious class. And then we repeated this with school performance to see if we saw similar associations, and our findings were quite similar. So here we found that children living in households with lower parental employment quality performed worse at school than their peers, and precarious employment once again stands out as a meaningful predictor. Moving on to our NLSCY, so that's our longitudinal survey that looked at parental job quality at 3 points in childhood and then youth reported emotional and behavioral symptoms. We found that both the primary earner model and the precarious model were associated with nearly double the risk of emotional problems in adolescence. And important to note here that actually our odds ratios look very similar between the two models. So we don't see a significant, meaningful difference between the primary earner and the precarious model in terms of the higher odds of having emotional symptoms. And then we found no association in this study with behavioral symptoms in adolescents. And just to note here that the behavioral problems that were measured in the NLSCY, they're quite different than the behavioral problems measured in the Ontario Child Health Study, where these were primarily self-reported aggressive behaviors that would be more aligned with fundamental conduct problems, compared with some more behavioral symptoms like inattention, hyperactivity, and oppositionality that were measured in the OAK. So the outcomes are slightly different between the two. All right, so moving on to our discussion. Just to summarize, firstly, we identified distinct patterns of parental employment in dual and single parent families. These patterns were high quality employment, where either in dual parent families, both parents had high quality jobs across most indicators, or in single parent families, the same. In dual parent families, a primary earner model where there was one parent who was usually a father who worked longer hours for higher pay, and a second parent who was usually a mother who worked fewer hours for lower pay. And then finally, a precarious group who had poor quality indicators across the board. In the OAKS, our cross-sectional survey study of children ages 4 to 17, we found that lower parental employment quality was associated with poorer child mental health symptoms, as well as school performance outcomes. And in our longitudinal study, we found that lower parental employment quality in childhood was associated with poorer youth-reported emotional symptoms. We found that our longitudinal design adjusting for baseline symptoms helped us to establish a causal relationship, which is like a starting point for some of our upcoming work. We'll briefly review some strengths and limitations. So in terms of our strengths, a really important point is that these data are representative of the general population to the best of the ability of the survey collectors, with some biases that obviously go into who participates in population level surveys. But this helps us to have more confidence in the inferences that we're making. That we have triangulation across multiple outcomes and multiple surveys. That was something really important to us, why we added the school performance outcome to our OAK study to see if we had some similar findings across different outcomes. And then importantly, added the National Longitudinal Survey of Children and Youth as our second analysis. So we see in different surveys with different populations of different ages collected at different times, really similar signal in terms of the associations between parental employment quality and child and youth mental health. And then finally, that our longitudinal design supports plausible causal inferences, but definitely not going to make assertions that are really confident there. In terms of limitations in our future directions, one thing that we have struggled a lot with is that data are old and may not reflect the labor market today. So important to just highlight the fact that we, until very recently, had essentially no population-based nationally representative or even provincially representative data collection on the health of children and youth in this country. So that ended in 2008 with the end of the NLSCY. We do now have the CHES, but it doesn't include, these measures that are more kind of robustly descriptive of a family's social and economic circumstances. And so in terms of our next steps, we have moved on to some US panel data that has strong representation of economic indicators. We're always trading off kind of robustness of the health outcomes to some degree with the economic indicators, which was definitely the case in the NLSCY. So OAKS was designed to be a really strong study of child and youth mental health, whereas a bigger population level survey can't have really rich measures of every child's health outcome. We wanted to highlight that the outcomes were self-reported and limited in scope. So we recognize that there are definitely biases inherent in self-reported mental health outcomes. So to speak to the parental reported outcomes, we can all expect that when parents are feeling more stressed, it's possible that they will be more observant of their child's emotional and behavioral problems and might report them differently than if they were less stressed, or they may be less observant because they're distracted by meeting their family's material needs. And then in terms of youth reported mental health symptoms, we know from multiple survey studies that the way mental health symptoms are reported by youth, is just like anything subject to some desirability bias. So that could contribute to why we found the findings that we did. And then again, highlighting the limitation in scope that comes down to a lot of the kind of richness versus representativeness, balance that you have to have in population level surveys. So in particular, the data that we're using right now that have strong employment outcomes don't have a lot of detailed developmental data. So they were mostly designed to measure mental health or measure other outcomes. And we're really curious about other child health and developmental outcomes and how we could find them in other data sets. And thinking even of primary data collection, but would trade off that population representation. And then really important, potential for residual confounding and reverse causality. I think anyone in here who works in child health, especially clinicians, understand that when you have a child with a chronic health condition or behavioral condition, that might have effects on your employment. And we definitely recognize that that can start very early in life, and are thinking actively about ways of accounting for that and addressing that. And at the same time, feel that that's an important question for parental job quality to begin with. What are the effects of a child's chronic condition on how a parent interacts with the labor market? All right, and now Faraz is going to give you his version of the key messages. You can see if they're the same or if they're different.
Thanks, Ed. So just a few minutes to round out, tell you a little bit again what we think are sort of the key messages, but also begin to, we hope, like reasonably speculate about implications from a few different angles. But in terms of key messages, hard to sort of narrow down given the data limitations that I sort of alluded to, that Anne kind of expanded on. Hard to tell you exactly what the sort of point prevalence of this problem is. But we think it's very safe based on what we've sort of seen in the surveys and the samples we've been working with to say that a lot of parents who are working are in fact working jobs that we might characterize as precarious. So they're insecure, they're unpredictable, they're low paying. Maybe some room there to talk about, and maybe we will, about the voluntariness or not of certain forms of sort of non-standard or non sort of immediately appearing to be high quality employment. But a point we try to stress in this employment quality world is that very few people are looking for insecurity and low pay. So I might be looking for lower hours, but I'm generally not looking for lower pay or insecurity at work. As a consequence of this being a sort of sizable enough problem affecting parents and working people in general, it is also affecting children. So we think that sort of in the same way that a sizable share of parents are exposed, a sizable share of children are being exposed to the negative spillover effects of this sort of problem of precarity. And in our case, the sort of the part of the sort of problem that we're trying to draw attention to is the consequences, the potential consequences that this precarity has for child mental health and development. And that sort of, presumably, and we hope, that if we as a society can sort of exercise some effort or greater effort to promote sort of the availability, accessibility of jobs that are stable, that are rewarding, that are gainful and secure and so on, that we're not only going to improve matters in everyday life for sort of working parents and working adults, the workers, but also that of other members of their household, including their children. So moving a little bit away from the results and sort of sharing some of the broader insights that we're grappling with and sort of also trying to pursue in the context of work that has now been catalyzed by the Catalyst grant. I mean, one thing we make an effort to stress in the research and the publications is that we live in a society where sort of the focus of family and employment policy is almost sort of singularly on how do we get people into work. Or in the context of family policy, the sort of longstanding, I think, room to say some history of problematic debate over like, should this parent or that parent be working or not, and so on. And so that conversation is dominated almost entirely on this idea of are they working or are they not working, and how do we get people into work if we believe they should be working, and so on. And that it's sort of what we're trying to do and amplify is that sometimes it may not actually be a function of whether you're working or not, but what are the terms and conditions of the work you're able to obtain in the labor market. So what's actually on offer in the labor market when we tell mothers or parents or workers in general, a job is the best thing you can do for your families. It's the best way to safeguard your children from poverty and hardship and so on. The labor market, what is offering people is very mixed, and what someone's able to obtain matters. From a more clinical perspective, we think there's sort of important insights here around when and where sort of should clinicians who are caring for children consider and take account of sort of parental employment quality, the terms and conditions of household employment as a potentially relevant sort of piece of the history and experiences that children bring and parents bring to clinical settings, and so on. From a research standpoint, we are interested in trying to uncover some of the mechanisms at play here, drawing on, for example, the family stress model and expanded versions of that model that Anne presented, but also sort of from an intervention perspective, what policies and programs work or don't work in terms of mitigating the consequences of precarity. And often when I'm talking about this, it's sort of like two levels of analysis. One is how do we promote good jobs through policies, but also in the context where a lot of people are unfortunately obtaining precarious jobs in the labor market, what are some programs that we can put in effect to mitigate the consequences of those who are not able to obtain those high quality jobs? And also, we think, just by way of conclusion, a potentially interesting theoretical argument here around understanding parental employment quality as a kind of not just social determinant or sort of root cause, but primordial cause of socioeconomic disadvantage in early life. So primordial in the sense of two ways of thinking about this theoretically. One is sort of what role is this playing in the intergenerational transmission of health inequality and labor market inequality? So I have lots of colleagues, for example, and I actually some in the room, who sort of study sort of the bidirectionality of these things. Well, we think the sort of findings that we're presenting add an interesting layer to that story of sort of when we talk about sort of the wage penalty of entering the labor market with depression or anxiety or a major another mental health problem, what history and like life course history and so on feeds into those sort of early adulthood experiences. Well, it could be something around sort of parental adversity in childhood and the sort of scar that might leave on one's mental health as a youth as they enter either schooling or they exit schooling and enter the labor market for the first time and so on. So we think there's an interesting theoretical argument, and we're not the first to make it, but an interesting theoretical argument around intergenerational transmission of both health inequalities and work and labor market inequalities here. But also primordial in the sense that this is probably a room where we very comfortably talk about income and poverty as determinants of health, very well rehearsed arguments, and for good reason, because they are determinants of health. But also somebody who's sort of an outsider to that literature and more so an insider on employment and work as a determinant of health. What's interesting for someone like me is to see how unobjectionable and sort of comfortable we are referring to income and poverty without any reference at all to jobs. For the vast majority of people in our society, in our capitalist society, poverty and low income are a function of a bad job, a job that is simply not providing the stability, rewards, gainfulness that a household, a parent, a person requires to meet their needs and that of their families. And in the same way, sort of not conversely, but the other side of that is if we are interested in promoting income security and we are interested in reducing poverty, it's sort of my role in the room to say, I really don't know how we do that without making jobs better. Given that, again, poverty and income are, for a vast majority of us, sort of a function of how gainfully and securely and stably attached to the labor market are we. And that's where we wanted to, I think, leave things off. Sorry. I terrible error on my part. We do want to obviously thank, this was a relatively large team, and we want to thank other members of the team, maybe some names, certainly actually some names that are familiar on the screen. Also Department of Pediatrics at Mac and the Offord Center, and in my case, the Institute for Work and Health. And just wanted to re-stress our gratitude to the Leong Center for the Catalyst Grant, for the work we've done and the work we hope to keep doing. If you want to learn more about the research, both of the studies we presented today are published and open access, so they're free to read if you're interested. And I think the slides will be shared with you as well. And then over to you.
Yourself, in case they don't know.
Great. Hi, I'm Emily Himovich. I'm a PhD candidate at CHES. Thanks so much. That was a really great and informative presentation. I was wondering, when you look at precarious jobs, if you've been able to separate at all or have any sense of whether it's income versus instability, for example, that might be driving this relationship with child mental health outcomes, or perhaps it's equal weight for both these aspects of a job if one holds more weight than the other.
That's a great question. I'll start because it's the start of our collaboration, is that question, which was for us and me hanging out and me saying, isn't this just all about income? And then him giving me a very stern talking to, which starts with that primordial explanation, I think, that he ended with, that number one, in order to have income, you need high quality jobs for the most part. To answer that in a more technical way, we do have some sense. And so in our first study, if you are interested, that's the one in the Journal of Epidemiology and Community Health, the OAK study. We did a sensitivity analysis where we looked at individual indicators, adjusting for income, to help answer this question for ourselves, because income was included in our latent class analysis for that study. And we found that some associations were meaningfully attenuated when you adjusted for income when we looked at each indicator individually. But some of them, including part-time work and irregular schedules, remain strongly associated with our outcome, even after adjusting for income. So our feeling is that income is undeniably an important determinant of child health for a variety of reasons, but that there are, beyond its role as a primordial determinant of health, there are, we think, elements of job quality that operate maybe through that processes mechanism that we are interested in exploring further, but that might, separately from the effects of income or low income, have an effect on the way families interact, the way parents parent, the way a child experiences their childhood.
Thanks.
Do you want to add anything to that?
Just that, like by way of example, sort of this is how we were thinking also about the results for those primary earners, where in general at the household
And
level,
those were high.
quite
Yeah.
decidedly high earnings,
Fine.
and yet we're seeing some sort of signal which speaks to probably not deficiency of income and material hardship, but some other process plot like potentially related to that gendered work pattern with like fathers. I think it was something like almost 50% of fathers working 49 or more hours a week kind of thing. So, again, I like to point out, sort of a society where like among those who are not in sort of our high quality group, you have a group of people who are potentially overcommitted and a group of people who are desperate for hours. And then we as a society need to start grappling with that problem, because maybe both of them are in fact problems. And yeah.
I'm just going to add one thing. In the past, when I presented on this, and we didn't delve into this in this talk, but there was a lot of interest in the latent classes themselves and how things play out in within the family dynamic of two-parent families. And I think that there is more to say that I won't say right now, but more to say about all the different ways that the decisions families make, or that they're forced to make, or the way things play out in a household that relate to work. And that we don't have evidence right now to kind of decide or suggest exactly what that might be, but I think it's another really interesting area that this brings up, specifically related to that primary earner model. That would be my only addition, but people like that in peds too.
So in the case, yes, sure. So Giancarlo asked whether we had information about parents' industries or sectors of work in addition to the dimensions I shared about. So simple answer is I believe in the context of the Oaks, we don't, but in the context of the NLSI and NLSCY, we do. I can probably somewhat safely tell you a little bit about that on the spot, but I like for the sake of time, what I'll tell you is that we didn't, in the context of these two studies, look at it, and partly that's a disciplinary. There's some like disciplinary history there of sort of people in the quality of employment world wanting to insist that this isn't about occupation and industry. That you can, for example, be a very securely, stably, gainfully employed nurse, or you can be a very, very precariously employed nurse. And that, these processes of polarization, dualization, and so on are making it so that when we're trying to grasp quality of employment, we don't want to collapse that with sort of occupational characteristics. I think it's a debate. Not people are thinking about this differently, and different reasonable ways of thinking about it, but maybe you want to share a little bit more about sort of what you had in mind. You probably had something specific in mind when you asked the question. Oh, okay. Yeah, I mean, generally for the precarious workers, we're seeing them in retail, we're seeing them in hospitality, food, accommodations. Um, and for the primary earner, with the sort of that gendered pattern of shorter work for lower wages, um, in what I've seen, you are seeing a ton of that in education and healthcare among the moms, a ton of that. But I can't tell you much more beyond that, but that's what I've seen.
Okay. Can you hear me now? Sorry. Okay, yeah. So, so one key takeaway for me that really resonates with me is that the presence of both the parents at home is really important to care for the child, and the stress level, the mental health, and this headspace of being there present. Fully present with the child at home is really important, because I, being the mother, and what energy I bring to my home when I'm done with my work here is really important, and I'm cognizant of that. So thank you for putting numbers on what I feel on day-to-day basis. Like equally, like both partners are important in raising a child with with the positive, for a positive development. Regarding the sensitivity analysis that you mentioned, I am more curious to learn more about the methodology, and especially like, can you put a sample size or the numbers on each of the profiles? Like, since you said like this is a population study and it's generalizable, so I would love to know like what's the group size of each of the profile A and B. Sorry, yeah, thank you so much. While you were explaining like the wage differences and what is the driving force or the driver of the relationship between wages and the type of employment, do you have any idea that at what wage threshold the result starts to decline, if you have the data on the wage threshold? And secondly, regarding the third profile of precarious employment, did you had an opportunity or chance to consider subgroup analysis? By subgroup analysis, I mean like who are the group of parents who are at higher risk, like immigrants, and we already know that the unemployment rate is at highest in the history in Canada and in Ontario. And there are subgroups, especially if we speak of social determinants of health, who are at higher risk of getting the employment in the first place, let it be the precarious one or unstable one.
A lot there. So I might take some and you might take some. So, firstly, your instinct is correct that these, like most risk factors, like most social and economic risk factors, not distributed randomly across the population. So, for example, we had a sort of supplementary slide here, just wanted to draw attention to the fact that sort of like what seemed to us to be the most important sort of discriminant factors in terms of likelihood of falling into one or another class in our samples seem to be things like whether you had completed high school education. Makes sense. Education is a predictor of sort of where you fall, what opportunities are available to you in the labor market, but also things like being born outside of Canada, so being an immigrant. And then sort of somewhat different angle, we did notice sort of higher preterm birth rates among those parents in precarious employment, drawing potentially some reasonable attention to that reverse sort of causality, the bidirectionality of these things of sort of children born with potentially certain, needs, complexities, and so on, therefore affecting parents' ability to attach themselves in certain ways versus others in the labor market. There was also a question about ends. So I don't know if this is a terrible, terrible mistake, but no ends in our slides. Ends in our papers, absolutely. I guess our thought was I guess our thought was sort of you'd be more like people would be much more interested in knowing what share of the population this represents, and that's sort of what we've put on the slides. The issue here is sort of depending on who you're asking. So if these are shares from the 2014 Oaks, 11,000. Yeah, I think we were just shy of 10,000 people. But like, aside from N, questions about like, how does Ontario relate to Canada? Questions about, depending on who you are, is 2014 outdated? I don't know where I fall on that, but I know I have colleagues who will say 2014 is unpublishable, kind of. So I think this is what we meant sort of by the what is the exact point prevalence. It's really tough, and without better data collection efforts from StatsCan and others, I'm not sure we'd be able to do that for you. 3,600. Yeah, 3,600. Yeah. 3,600, I think, for the NLSEY. Yeah. But for me, the generalizability concerns are more so less about sort of sample size and more about what does 2014 represent? What does, in the NLSEY, 1994 to 2008 represent? What aspects of that do we feel comfortable generalizing to 2025? What aspects of that don't we?
Add one more thing about sampling strategy, at least for the Oaks, which was, intentionally oversampled families with low income, families from low income neighborhoods, and also newcomer families, just to make sure that those groups were represented in the Oaks. That wasn't an intentional part of the NLSEY sampling strategy, which was more about population representativeness, but Oaks oversampled in those areas to ensure that they had robust data collection to answer questions related to those as potential determinants of health.
Thank you so much. Great work. I'm sure you have people from StatsCan in your group, so they would probably know best. But the NLSEY has been linked to other possible data sets. Is it, can you follow these individuals over time and look at their tax records and stuff?
Strongly, so you go first.
No, you go first.
Well, maybe my answer is boring. I was going to say, yeah, we can. And I think I am interested, but maybe the reason I'm interested is because I until recently, haven't studied child outcomes. So the idea of sort of, for those of you who don't know, there was like a really big effort, I think maybe 4 years ago, where StatsCan said, gosh, we are the only rich OECD nation without a longitudinal social survey. What can we do that's not that expensive, like introducing a new longitudinal social survey? We can link. I think they had a program called Extending the Relevance of Longitudinal Files. And so they said, what if we linked things like the NLSEY, but also the SLID, which was our labor and income survey before it was terminated, and also the NPHS, which was our longitudinal health survey before it was terminated, all around the same time. What if we linked these outdated, now no longer really being used, longitudinal social and health surveys to sort of 13 prospective years of all sorts of health administrative data, NACRs, DAT, hospitalizations, mortality, cancer database, and so on. And I think I am very interested, but I believe I have colleagues on the team who are much more worried because they are much more knowledgeable about what it means, for example, to study health service use among children and young adults and so on than I am. So I naively am very excited by all the health admin data that I don't often get to work with, but I believe they are.
No, I think I got excited because I just want to highlight Jeanette Como at King's University College in London. She like we're on a grant that is looking at, she's interested in multi-generational social assistance, a very similar construct to what we're doing. And she's using right now the link, NLSCY linked to some of the health administrative data and tax files. And so that's kind of an experiment. We're going to see how that goes before we extend it to our questions of job quality. But I think for us, we almost did an operating grant to look at the linkage last year. And then we just got a bit concerned about service use as an outcome. And I think that right now that is our hesitation a bit, is what are we making of service use, especially mental health service use, acknowledging that we don't feel comfortable relying on diagnosis as exists in OHIP, that the vast majority of mental health service use happens outside of the publicly funded healthcare system in a way that's billed to OHIP. So it's definitely something we're thinking about and excited about the idea of it and the opportunities. But we took a hot minute before diving into it when it became more available last year or the year before. But it's a really amazing opportunity, hard to ignore, having all of these years of data collection in childhood linked to administrative data going forward.
And can I ask just a tiny bit on top of that? The labor force survey, is this something that you could put? I know that the problem is finding the kids in that, but the labor force survey has a lot of very useful information that I know exists within StatsCan, but I don't know if it has ever been linked to other data.
So vast majority of you don't know me, but I do like collegial provocation, constructive, collegial. So the limitation is actually that the various divisions of StatCan don't enjoy, from what I can tell, pardon me, this is recorded, I apologize. No, but in all seriousness, my sense is that you have one group of people working on health admin, one group of people working on census, one group of people working on labor and econ, one group of people working on CC. And it's actually, from what I understand, quite difficult to sort of fund and get the logistics and the staffing and the time and the hours and the whatnot to say, can you link something like the LFS to health admin data, or retrospectively to NLSCY and SLID data from the 90s and 2000s. I don't believe it's technically impossible, but I think it's also, and I'll come to the defense of StatsCan as well, collegial, that I think they're just what if there isn't enough of an appetite? So you invest all this money in these novel linkages, and then you have Faraz and Ann who are great, LFS linked to, and one team but are there other teams that are also interested in LFS linked retrospectively to NLSCY, linked prospectively to DAT? Maybe not. And then reasonably, this federal agency is saying, it just doesn't make sense. Maybe that changes over time, but that's my read on the situation. Hopefully a fair read, and hopefully I don't get in trouble for that. Yes. Okay. I thought we were here until 1:30 anyways.
I think we're all here until we're going here for 1. Okay, but formal. Go ahead, Colin.
Okay, that's my time up, is it? So first of all, great presentation, very clear. It was really easy to follow, so thank you for that. I've got 2 quick questions. One is about the sensitivity analysis, any impact on your results when you adjusted for parental mental health? And my second question is around, if it's a Catalyst grant, you've done this, you've got all these limitations, what's your program of research to answer the question more definitively?
It's giving me his grin. It's very dangerous. So we didn't do, just to clarify, a sensitivity analysis adjusted for parental mental health, just one adjusting for income. I would say that we feel quite as convinced as you can be that parental mental health is in the causal pathway. It would be fun to test it out. And then so we've talked about that could lead conveniently into our next steps. But we've talked about some more formal mediation analysis that actually test that. So we have this Catalyst grant. I don't know if Faraz is sick of me yet. So but basically where we are now is kind of it's a great partnership because Faraz, I don't want to speak for you, but I think that I will. Faraz is, very brilliantly firmly in the camp of this being, is it fair to say, a policy question, right? This is a labor policy question. We're generating evidence to support labor policies or social policies that promote high quality employment for everybody. And in the case of this research, for families, and for the benefit of children. I still like, I still have half of my or 1 foot in the clinical world where I'm thinking about, what does this mean for primary data collection? What does this mean for intervention? Is this something that can be intervened upon in a smaller setting than at the population level? And it leads to like great conversations between the two of us. I think we're staying more in the first camp right now. So we have, just getting back to Petros, we have started exploring the idea of using some of the linked data, but we've also moved on to some US panel data right now. So there are a few great US panel studies. Probably the strongest one for our purposes being the panel survey of income dynamics, which is run out of the University of Michigan. And this is an amazing 11 generation survey study of families with really robust economic measures, but also child development and well-being and mental health measures that is publicly available for now. So as long as we can access it, we have started working on some more longitudinal analysis and even multi-generational analysis using that survey that will give us the opportunity to test mechanisms like the different mediators we proposed in the family stress model using things like structural equation modeling and other strategies. And then at the same time, we've got some work going on right now in the city of Hamilton that is focused a bit more on like youth job quality, youth employment, partnering with some community centers, thinking about, how can we use some of our population level lens to think more concretely about what youth are looking for, because I'm a pediatrician, that's the world I live in. And I think that, there is some work that we're not involved in yet, but that we think about sometimes in terms of what is the role of clinicians specifically in thinking about the quality of the work, of the jobs of the parents of the children they care for. So I know, for example, for children with medical complexity, this is like a huge issue. What do we do? Are we helping people with job navigation? I don't really live in that world, but are we thinking about what effects it has on, I give Faraz examples all the time of patients whose parents can't get a half day off work to come and see me. And so instead they drive to the school, have the virtual visit in the car, go back and drive back to work. How can we in the healthcare system, even if we can't change the quality of jobs or we don't see that as a clinical objective, how can we make our healthcare system more friendly to families who are really facing these like problems with job precarity? So I think that's another angle, but right now we're really at the population level still. I have to work on him for a while.
So critical. Thinking about new ways of harnessing data, addressing equity issues, really everything that we deeply is important to support. If anyone has, I know there was questions in the back, and I think Paul had 3 more questions. If anyone has more questions about us and Anne are both here to address them, but thanks everyone for joining, and please.
Thank you so much for your to see it get funded. I had a question about that people with vulnerable status finding some population. I think about precarious